What is a PCOS lifestyle change? I want to first begin this video by saying I am so sorry if you've ever been met with a comment from your healthcare provider that says, just lose weight. Why don't you just lose weight? Or some other shaming comment. We know with PCOS, if you have hormones that are imbalanced or cortisol levels or inflammation in your body, you could do everything under the sun that's correct and your body is going to be working against you and you cannot just lose weight. There is a very specific process to go through to lose weight or for lifestyle factors that deal with PCOS. These are just a few of them I'm going to share with you today. I want to empower you to seek out care from a healthcare provider who listens to you and feels heard. I have included in today's video notes my favorite PCOS handout that I created that includes lifestyle tips, supplements, labs, and more. Let's begin. Lifestyle changes for PCOS. We know that being diagnosed or not being diagnosed with this yet is very overwhelming and it's hard to understand. You've perhaps implemented some things or you're trying things and they're not working. And so I wanted to share with you today a few things that I share with my patients to help them not only lose weight, but feel better and feel better every day so you can do your job and be a functioning female. This disease can make you just feel so run down, so tired, have your hormones and your emotions all over the place. So the key to this is blood sugar management or insulin management. Many women with PCOS have an imbalance with this. And so what does that mean? There's also a misconception about carbs and for those with PCOS. So for example, the thought process is I'll meet with many women and they've cut carbs out. They've tried cutting carbs out. And that's a misconception. We want you to eat carbs. There's many different kinds of carbs out there, and some are just better for you. So here's a rundown on some of carb ideas that I share with my patients. Quinoa, lentil pasta, sweet potatoes, chickpea pasta, brown rice, fruits. Yes, you get to eat fruit. Vegetables, these are just a few. Healthy fats. I want you to be eating healthy fats such as avocados, avocado oil, nuts, seeds, coconut oil, coconut flour, nut butter, salmon, tuna, ground flax, and these are just a few. Putting just a little bit of ground flax in a smoothie can positively impact your insulin levels. There's a discussion within the community about going gluten-free and dairy-free, and quite frankly, I feel that can be hard for some women to do. So making small adjustments in your day and possibly working towards those goals, or even taking a food sensitivity test to determine what is causing you inflammation. I used the example of a patient I had where I was about to pull dairy and gluten from her. We did a sensitivity test and she's allergic to egg whites and garlic. Those were red. The dairy was a very mild thing for her, and she really liked her dairy. So I think determining what is causing you inflammation that can help make you feel better is really important because remember, a big thing I share is making a plan for your PCOS should be individualized for you and what's going to work for you in your day-to-day life. Protein. Protein is one of the most important things to help stabilize all of our levels of insulin. This is something I do and I don't have PCOS. So pairing protein with all your snacks and all your meals can stop your insulin from doing a roller coaster ride. We know that protein takes approximately 5 hours to metabolize. Carbs are 30 minutes. So you get this roller coaster effect with your insulin levels. And knowing that something as simple as putting protein in with your meals and snacks can be huge to positively improving how you feel throughout the day. I want you eating every 3 to 4 hours. No more skipping or fasting from your meals. I want you to try to eat more often. This, once again, can positively impact and stop that roller coaster effect from going on. Have you heard of the 80-20 mindset? I find this for myself personally and my patients to be super beneficial. We all have events or holidays or family traditions, cultural traditions where food is a very important part of that routine. 80-20. So stick to these lifestyle changes or following your lifestyle changes 80% of the time, and give yourself grace and permission that 20% of the time you can enjoy those events and then jump back on your lifestyle plan after those events are over with. Restrictions can feel hard and lead to feelings of guilt and shame and makes us just stop doing it altogether. So I want you to understand that the 80-20 mindset is one that works best for not only myself, but also my patients. Meal prep. I find, once again, for myself and my patients, meal prep can be a great way to stick to something or just take that stress off of our weekly routines by having it done at a certain point in your week. It may not always be a Sunday or a Monday. Pick a time and date that works best for you to prep snacks and prep some of these meals and prep your protein to make it easier during the week to follow. What's the best type of exercise for PCOS? You're gonna find so many things out there on this topic. Number one, you have to enjoy it. I cannot force you to go do a form of exercise that you don't enjoy just because it might be better. So it might be as simple as walking, especially after large meals, going in for a walk. My favorite hack is a walking pad. I've added a walking pad to my desk lately and found it super helpful to make sure I'm getting my steps in, and I can then do it after my meals. Strength training. Light strength training, finding something to build some muscle mass to help better regulate insulin levels and also help your body better utilize insulin. My number one rule, like I said, is you have to enjoy it. And if you're someone who's doing a lot of HIIT workouts, I encourage you to try pulling back on that and seeing if you feel better, seeing if your weight goes down. My patients who are doing more than 2 to 3 HIIT workouts in a week sometimes find that it backfires on their insulin, but also their cortisol levels, which causes inflammation and insulin issues. So don't feel like you have to be going really hard on your workouts and doing high intensity workouts that often during the week. Sleep. I know this is hard. We all have issues at one point or another in our life with sleep, but make it a goal to aim for 7 to 8 hours of high quality sleep per night. So where you're not tossing and turning and you're not waking up so many times during the night. Dark room. Get the room darkening blinds or curtains. Have a sound machine with white, brown, or pink noise. Keep your room cooler at night so you're not waking up sweaty or warm. These are all things that can help improve your sleep. We know that studies have showed that 6.5 hours or less of sleep per night is linked to higher fasting insulin levels and insulin resistance. Do you see a theme here with insulin resistance? We also know it can lead to sugar cravings, carb cravings, and it's just very important part of our overall health, our immune system, to make sure you're getting high quality sleep. These are just a few things that you can implement. If you like today's video, make sure to hit like and subscribe for more weekly content. And please share this video with a female in your life who you feel can benefit from these tips and wants to feel empowered and take back control of their healthcare.